Yes. So red, as we all know, is a type of opioid. It is made up of two powerful painkillers. Opioids are strong painkillers. We call them analgesics. And just like paracetamol, there's brufen, but they are stronger ones. And because they are stronger and because they have addictive potential, their access is restricted. But because of some people's commercial interests, they have tried to find ways to push these drugs into our youth. And what opioid does is that, I mean, it's even though it gives you some relief from your pain, and some of them come with some kind of euphoria, because it goes to the brain, a place that stimulates or releases dopamine. So people like it. But what happens is that with time, you become addicted to it. And in fact, when professionals are prescribing this drug, we don't prescribe it for sometimes more than a week, sometimes 5 days, because we know that it is addictive, it has addictive potential. But unfortunately, because people are having access to it, they keep on taking it. And as you keep on taking it, it gets to a certain point, your system becomes used to it. So with that, the drug, it looks like it can't function. Or when a drug is getting what we call withdrawal, when you're going through withdrawal, I mean, the whole body system is affected. The person will be sweating, the person's vision will be affected, the person will be having upset stomach, it will be running, the temperature will be having so everything is disturbed. And sometimes it's very uncomfortable. So they are even tempted to go back and take it again. So that's how come they become so addicted. And at this point, we will need health professionals to come in to support the person. So that's how come you have what you call detoxification. When the person comes to the hospital, we want to get the drug out of the system. So we take the person through a number of medical practices. Maybe sometimes you admit the person, flush the system, give some person some medications to be able to manage the withdrawal symptoms in a medical way. But because of its bad withdrawal symptoms, it's very difficult for people to stop on their own. So that's how come red is becoming very rampant these days. It used to be tramadol, now it is red. We don't know what will happen next. So that's how come I'm even calling for more investment into evidence-based prevention intervention. I don't know whether you know about DARE. DARE is Drug Abuse Resistance Education. It used to be one of the evidence-based, one of the interventions that the U.S. government implemented. But when they evaluated, they saw that it's not evidence-based, so they stopped. So there are evidence-based interventions that we can even teach like teachers to be able to identify young ones with mental challenges and refer them to treatment. We can also teach parents parenting styles, effective parenting styles. We can also teach young ones what we call SEL, social and emotional learning skills, which combines a number of things. We can also use laws like taxation, we call them sin taxes. When you use, evidence shows that taxation has a way of controlling access to drugs. And we also have laws like ban on advertisements. We have been saying that like tobacco, cigarettes, they should put warning labels on them. I mean, we should also not sell drugs like in Ghana. We should not allow drugs that are labeled in another language. It should be in English so everybody can read. So these are all measures that we have to put in place. We must also make sure that we don't restrict access to, like in schools. Alcohol joints are not so close to the schools. These are all evidence-based. Even relationship between parents and their children, relationship between teachers and their students, and even how the school classroom is organized. It all has, we call them evidence-based intervention that we can implement that can help to curb the drug addiction situation we are having now. So a lot of what I would say is that the laws are there, but it's the implementation. So we know that when you go to this supermarkets, they say that alcohol is not sold to people under 18 years. Who enforces that? Because these days we're having young people who are looking like 25 years, 26 years, and they go there. You need to show evidence. So we need to implement that. We also need to empower people who sell, regulate those who sell alcohol, that they shouldn't sell it at certain periods of the day. They shouldn't open, or they should not situate their shops close to schools. Are we okay? Then we also have what we call responsible bar attendant behavior, so that we teach people who are selling that you sold alcohol to this person so that the person is really drunk. You still keep on selling it to the person. It's not right. The person is drunk, so you should stop it, Or even check their their age limit, because just like I told you, at other places outside, they check your ID card to be sure that you are really somebody who's above 18 before they sell these things for you. So government has, the laws are there, but it's about the implementation and also investing more into mental health and as well as what? Evidence-based prevention, intervention, and we are creating the awareness. But if we don't invest more in evidence-based prevention, we're going to make headway. People will be aware, but they still have the situation going on. So we need to what? Invest more. And WHO has said it. Everybody is saying that let's invest more into mental health. Once we invest more into mental health, I mean, it has, the ripple effects are numerous, and we have the benefits as a country. The youth that are on opioids, I'm saying that we are saying that for young people, you don't want you to use drugs because your brains are still developing. So when you use drugs, brain has the potential to impede the full development of your brain. So please, if you have not started using, don't do it. But if you have started using, please, there's help out for you there. We have help. You can call the Mental Health Authority toll-free line 0800 678 678 0800 678 678 if you need. And please, for the parents, don't wait till your child gets to rock bottom. When I say rock bottom, it means the situation is so worse. Once you see the tell signs that the person is using drugs, connect the person to a psychologist. Now, you don't need to walk all the way to the psychiatric hospital for support. Any government hospital, there are clinical psychologists, there are mental health professionals who would listen to you, assess you, and give you the intervention that you need, or refer you to a professional who can be of help. So please, the youth, you are the future of this country. Drugs cannot do much for you. For now, you enjoy it, but the long-term repercussions are there. So please, if it's possible, don't start at all, and don't follow your friends. For those of you who are using, don't recruit others to join you, because we know the effect of what? Peer pressure. I mean, and if you're a young person, seek for support. Tell your parents, confess, tell your parents, or you can even walk to our hospitals yourself, and we'll give you the support you need.